Hello, my name is Jonathan Rohrbacher, and I'm a family nurse practitioner student at United States University. This is my patient, Jacqueline Brewer. And Jacqueline, do I have your consent to video record you for my MSN 572 health history and risk assessment video?
Yes, I, Jacqueline Brewer, consent to being recorded.
Thank you. Hi, Jacqueline. How are you doing today?
I'm good. How are you?
I am doing well, thank you. My name is Jonathan, and I will be performing your review of systems today. Okay. So what brings you in today?
Just a yearly checkup.
Okay, great, for your annual checkup. Mm-hmm. When was the last time you had a checkup?
Last year.
Last year, great. Okay. Are you having any health issues right now?
No.
Okay. Do you have any significant past medical history, any health issues?
No.
Okay, great. Do you have any allergies?
To cat hair.
Okay. Do you have any allergies to any medications?
No.
Great. Other than cats, anything in the environment, outdoors, that you could be allergic to?
No.
Any foods?
No.
Okay. Have you ever had any surgeries in the past?
No.
Okay. Any hospitalizations?
Nope.
Okay. As far as vaccines or immunizations, do you know if you're up to date on your vaccines?
Yes, I got the flu shot this year.
Great. Very good. Are you on any medications currently?
No.
Nothing prescription, anything over the counter?
No.
Okay. That's great. You must be very healthy. As far as how would you describe your diet?
I have no diet restrictions.
No diet restrictions. How's your appetite?
Normal, I think.
Okay. How many meals do you usually eat a day?
3.
Okay. And do you exercise? Are you physically active at all?
Yes, I bike probably like 2 to 3 times a week.
Okay, great. Around each time that you bike weekly, how long do you think?
Probably 30 to 45 minutes.
Okay, great. Okay. Do you consume any alcoholic beverages?
Yes.
How many drinks in a week would you say that you consume?
Depends, but probably around 2.
2 a week?
Yes.
Okay. And you don't feel that you have any problems with alcohol?
No.
Okay. Does anyone in your family drink, or your friends?
Yes.
Both family and friends?
Yes.
And how often would you say?
The same amount.
Okay. So just socially, would you say?
Yes. Mm-hmm.
Okay. Do you use any illicit drugs?
No.
What about marijuana?
No.
Okay, great. Do any of your friends partake in any illicit drugs?
No.
Okay. How is your family life? Your support with your friends and your family? Are you close with your family?
Mm-hmm. Yes.
Okay.
Very close. 2 sisters.
Great. And you feel safe at home?
Mm-hmm. Yep.
Are you currently in a relationship?
No.
Okay. Are you sexually active?
Not right now, no.
Are you, do you use any form of protection, any oral contraceptives or other forms of birth control?
No. Okay. Not currently.
Do you happen to have any history of a sexually transmitted infection?
Nope.
Alright, so I'm going to go over just a general review of all of your systems,
Okay.
just ask you if you have any issues. Okay. So in general, how do you feel how would you rate your health?
Fairly good. Can always be better.
Okay, what makes you say that it could be better?
Probably not drink so much, go out as much,
Okay.
eating better, healthier diet. I try to do everything I can.
Okay. Any issues with your vision or seeing?
I have contacts and glasses,
Okay.
but I do go to the eye doctor every year.
Yearly, great.
Yes.
Okay. Any issues with your ears or hearing?
No.
Okay. Do you ever get an ear checkup?
No.
Okay. Any history of any sinus infections, ear infections?
No.
Okay. Any problems with your nose? You said no history of sinus infections. Do you ever get congested? Any drainage?
No.
No.
In the winter, a little bit, but not normally. No.
Okay, what happens in the winter?
I often get colds, like runny nose, but I just take over the counter things. Nothing right now, but.
Do you know what medications you would take for your nose symptoms?
Probably Mucinex or Dayquil or NyQuil. That's pretty much it.
Okay. How about any issues swallowing food or water?
Nope.
Have you ever had strep throat, tonsillitis?
Had strep throat probably like 10 years ago.
Okay. You haven't noticed any sores in your mouth, any lesions?
Nope.
Okay, great. All right. No history of any heart problems? Do you ever feel like your heart's racing too fast?
No, but my grandma and my mother both have AFib.
Okay, that's great to know. But you yourself have never had any cardiac issues? Okay, great.
Not yet.
No issues with fainting, passing out, dizziness?
No.
Okay. And how would you say that your overall breathing is? Do you ever have any shortness of breath, difficulty breathing,
No.
coughing?
Nope.
Okay. And what about your stomach and your GI system? Any abdominal problems?
No.
No issues with diarrhea or constipation?
No.
You move your bowels regularly?
Yep.
And what about urinating? Any problems with urinating? Any history of UTIs?
Nope.
Okay.
Nope.
All right. Any muscle aches, joint aches, weakness in any of your extremities, coldness,
No.
heat? Okay, great. Any issues with skin? Any rashes, open sores?
I do have eczema.
You
I've
have
had it since
eczema?
I was a little kid, so a very long time.
And-
Only in the winter it seems to be a problem, though.
Okay. And where do you usually get your eczema rashes?
On my hands and usually my arms.
And what do you usually use to treat your eczema?
I have been on hydrocortisone before, ointment,
Okay.
but normally just like a Eucerin, like a very thick over-the-counter
Okay.
lotion.
You've never had to use anything prescription for it?
No. I think one time they gave me a prescription hydrocortisone, like very strong ointment, but other than that, not really.
Have you ever seen a dermatologist?
Yes, I have
Okay.
for that.
Do you see the dermatologist regularly or just when you have problems?
Just when I have problems. No.
Okay. When do you think the last time that you saw one?
Probably 3 years ago.
Do you perform self-breast exams?
No.
Okay. We do recommend that it's always good to start performing self-breast exams early. Do you have a family history of any problems, any breast cancer?
No, not that I can think of.
Okay. Do you see a gynecologist?
Yes.
How often?
Yearly.
Any problems with confusion? You said you don't have any dizziness.
No.
Any trouble? Do you have numbness and tingling anywhere?
Nope.
Okay. Do you have any history of any psychiatric issues? Any behavioral problems?
No.
Any aggression? Mood disorders?
No.
Okay. No history of bleeding disorders?
No.
Okay. No history of any thyroid problems?
My mom does have thyroid.
Okay. Do you know exactly what she has?
Hyperthyroidism?
Okay. Is she on any medications for that, do you know?
Mm-hmm.
Okay. Do you happen to know what it's called?
She's on Synthroid.
Okay. No other adrenal problems that you know of?
No.
Any endocrine disorders?
Mm.
Okay. You already told me about your allergies. All right, I think that concludes our review of your systems today. Do you have any questions for me?
No, I do not. Thank you.
Okay, well, next we'll perform your assessment, and then we'll make a plan and we'll go from there.
Thank you.
Thank you.